We presented preliminary experience data from a phase 1/2 study of Mosunetuzumab, a new bispecific antibody that targets CD20 on B cells and CD3 on immune effector T cells for treatment of previously untreated patients with diffuse large B-cell lymphoma who were not fit for full dose standard chemoimmunotherapy because of their age or impaired functional status. So this is an ongoing study. We have presented results of the safety cohorts. So there was a small 7-patient dose escalation cohort and a second dose cohort and a subsequent expansion cohort. So altogether, we have currently 29 patients who received this treatment and are evaluable for toxicity and efficacy. And among these patients, these patients were, as I said, impaired either functionally or through comorbidities and not eligible to get chemotherapy. And they received single-agent treatment with Mosunetuzumab, the bispecific antibody, initially during a step-up dosing during the first cycle to mitigate the risk of cytokine release syndrome, and subsequently with a dose of an antibody every 3 weeks for up to 8 cycles. So it's about 6 months of treatment with a response assessment after 4 and after 8 cycles. Among these patients, there were a few toxicities. The principal toxicities were related to the immune effector mechanism, and so this was a cytokine release syndrome at a rate of about 20%. But most of these cases were grade 1 cytokine release syndrome, which essentially consists of fever and some chills. There was one episode of one event with a grade 2 CRS, which also resolved within 24 hours. And really all of these events occurred within 24 hours of the first administration of drug and not beyond that. There were no significant events related to neurotoxicity, unlike with CAR T cells. And altogether at present, it appears that over 60% of patients achieve response to this treatment, and approximately 45%, so slightly less than a half, achieve complete response. And most of those who do so, or essentially all of them who achieve response, do so at the time of the early assessment after 3 months of therapy. So far, all patients who achieved complete response have sustained this response. The durability of these responses remains to be seen. This follow-up in the study is still short, but if we can confirm that these patients remain in complete remission, this would be one of the probably the first study that where patients potentially are cured with from diffuse large B-cell lymphoma using a bispecific antibody alone without any chemotherapy exposure.